and welcome to another edition of EDX Video Pro, the channel where you're going to find medical education for the healthcare professional or healthcare enthusiast. My name is Dr. Carlo Ojer. I am an emergency medicine physician, and I started at DrER.tv channel posting educational videos, procedure videos, family stuff, all kinds of different things. And now you're watching EDX Video Pro, which is strictly to cases in education, things you can learn about. So today we're going to discuss the case of possible stroke associated with a rash. This is a 72-year-old man who presents to emergency department with right-sided facial weakness. He reported a 1-week history of right ear swelling and discharge, for which he was already on antibiotics augmentin, amoxicillin clavulanate. In the 2 days before presentation, he noted increased dizziness, followed by facial droop and hoarseness in his voice. On exam, there was a crusted rash with drying vesicles over the right external auditory meatus and right-sided facial paralysis with sparing of the forehead, as evidenced by the preserved ability to raise his right eyebrow. This raised concern for an upper motor neuron 7th nerve palsy. The results for urgent CT scan made sure it wasn't a stroke, but it was unremarkable. Further examination revealed reduced blink rate of the right, sensorineural hearing loss. We had a little bit of loss of hearing, dysphonia and difficulty with his speech, and uvular deviation to the left. The results for the remaining cranial nerves and limb examination were normal. Let's take a look at the pictures. Here's the rash, and you can see the vesicles over here. You can see the crossing around the eye and the redness and swelling around it. So the initial provider that saw this patient thought this was just a cellulitis and started the patient augmenting. But a lot of times this type of rash is missed for infection or something else until it's clear that they have vesicles and it's crusted, and then it's much easier to make that diagnosis. This is the exam of the patient in terms of cranial nerve deficits and stuff. You can see the right-sided facial weakness and drooping over here. But the forehead is preserved. And this is important. Usually with strokes, that's when you do get a preservation of the forehead muscles. With facial nerve paralysis, you get the whole face because the facial nerve is affected as all the branches come out, and that causes whole face weakness. Actually, for me to see somebody with sparing of the forehead would increase the risk or the suspicion that this is a stroke we're dealing with as opposed to a facial nerve palsy like Bell's palsy. So this is a case of Ramsey-Hunt syndrome. You got to know this one. Ramsey-Hunt syndrome is herpes zoster oticus. That means it's affected ear. But it also has bulbar involvement. Ramsey-Hunt syndrome normally results in lower motor neuron 7th nerve palsy, in which the whole face, this is what I was talking about, including the frontalis muscle, demonstrates weakness, so the whole side of the face is affected. Sparing of the forehead and preserved ability to raise both eyebrows was therefore an unexpected finding, likely because of early presentation before full paralysis of the facial nerve developed. In case of facial paralysis, blink lag, indicative of weakness of the orbicularis oculi, is suggestive of early and evolving lower motor neuron lesion. Cerebral imaging for involvement of the cavernous sinus and leptomeningeal involvement is prudent. There's evidence of abnormalities of other cranial nerves. The patient was treated with intravenous acyclovir, magnetic resonant imaging, which is MRI of the head, and cerebrospinal fluid analysis. Results were normal, and at 6-month follow-up there was no residual facial weakness, although dysphagia and marked right-sided hearing loss remained. So Ramsey-Hunt syndrome, guys, is something you gotta know. You're gonna be quizzed on it. It's gonna come up at some point or another. Anytime you see herpes zoster in the face, there's Ramsey-Hunt, and there's Hutchinson signs when it's actually on the tip of the nose, and that one increases your risk of it affecting your eye. You got to know these two because you're going to impress somebody by knowing them, and because the suspicion of you dealing with something like this would increase the likelihood of you making the accurate diagnosis and therefore adequate treatment. Now, normally for herpes, you just treat acyclovir orally, or valacyclovir, which is 3 times a day. But in this case, because of the involvement of the inner ear, of maybe even central motor neuron, the patient was treated with intravenous acyclovir, which means the patient was indeed admitted to the hospital for treatment. So this is something pretty important to realize, that not all Bell's palsy, not all herpes zosters of the face are created equal, and definitely require different aggressiveness to treat this. So this is the point to take: Ramsey-Hunt syndrome, and remember Hutchinson's sign when it also involves the tip of the nose, as the risk of the eye involvement, ocular involvement, is much higher. And not all facial palsies are Bell's palsy. If they also have a rash associated with it, you got to think about this syndrome. Hey guys, I hope you learned with this video. I had a lot of pleasure doing it. I reviewed some things that I needed to review and learned as well as you did. So if you're liking this video, please do comment, please ask questions, please forward it to other people interested in this kind of stuff. That helps me keep me motivated and producing more content for you. Take care, guys. Bye-bye.